guess that we have to circle back and for Grow Cedar Valley to host a town hall meeting like this, but important to in our continued partnership with Blackhawk County Department of Health. It's great to have the band back together. As Carrie said, and she broke up a little bit, so if you didn't hear that, please submit your questions in the chat and we'll try to get those answered. But Nafissa, I'll start with you this morning and kind of give us a state of where our community is at and any opening comments you have, and then I know you have some team members with you this morning.
Yes, well, thank you everybody, and thank you Grow Cedar Valley for hosting this. I think it's very important that we stay engaged and connected with each other during this process. As I've stated, I don't know if some of you all saw the video before the press conference before the July 4th weekend. COVID is not over. The pandemic is still here, and we are seeing an increase in cases, and in particular in the younger population now. And so I thought it was very important that we engage with you all, because we're also seeing businesses voluntarily close because of limited staffing, and that's hurting us as well. And so I thought it was important that we figure out, what are some of your questions, your concern, and how we can assist you all to remain open, and to remain open safely, so that you can also be of service to the community, and the community also understands. So it's our responsibility as a health department to partner with you all, so that we can be that one voice for the community, and also share some of those preventative measures so that businesses can stay open and can thrive, and do it safely. So that's why we're here. I have the team with me that they will present. I want them to introduce themselves, but we're gonna give you all information in regards to data, where we're at as a community, and also what we're seeing with our businesses. And then I will loop back with you all, because I have a particular ask, and I want us to talk through what this ask means, and how we can partner and do this together. So with that said, Josh, please go ahead, and then Mike, there's some legal issues that perhaps you can briefly touch on after Jared. So go ahead. Thank you.
All right, thank you, Nafissa, and thank you everyone for having us here today. We've been getting a number of questions over the last couple of weeks, particularly about what businesses should do when they've had a case or had a case that's been exposed. So I'm going to go a little bit into in depth on what that looks like. But first, just want to start off with the kind of a data summary of where we're at right now. And unfortunately, COVID has been increasing quite a bit over the last 2 weeks. We went from an average rate of 5 cases a day up to 21 cases a day over the past 2 weeks. And we've seen some large spikes within that, sometimes over upwards of 50 cases in a day. So unfortunately, we're seeing quite a bit spike. And as Nafissa said, about over 50% of our cases have been in the 18 to 30-year-old age group. So we're really seeing that younger population affected right now, which is a population that's going out to a lot of businesses. And unlike when we were spiking in late April, early May, when most of our cases were tied to a single outbreak, or a group of outbreaks with the long-term care facilities, we're now seeing cases just throughout the community. It's not a centralized outbreak, it's just large number of cases out in the community. So like I said, we've been getting usually several calls a day about businesses wanting to know what to do when they've had an employee who's tested positive or who's been exposed. So I'm going to walk through some guidance on that. And really the most important thing is when someone has tested positive or when they've been exposed, that individual be excluded from work following the self-isolation guidelines. So when someone's tested positive, They should be excluded from work and self-isolating at home for at least 10 days after the start of their symptoms, or if they didn't have any symptoms and just went in for testing after an exposure, at least 10 days after they test positive. So at least 10 days after their symptoms started, they're tested, and they've been fever-free for 72 hours without the use of medication, and their symptoms are starting to improve. And they need to really meet all three of those criteria before they come back. So if they're feeling better after day 3, they need to still be out until at least 10 days after their onset. If at day 10 they're still having a fever, they need to be out longer until the fever's been gone for 3 days. And if at the end of their 10 days they still have a really bad cough, or they're still having other symptoms, they need to continue to be out until those symptoms start to improve. So we see sometimes where people are ready and they can go back right at that 10-day. And we see instances where people are out for several weeks or sometimes even longer than that, depending on the severity of their illness. I saw a question come up in the chat. So with people who aren't having symptoms and test positive, they need to be out for 10 days since the day they were tested. So it's the day that sample is collected. 10 days after that, they can come back to work. And that's assuming they don't develop any symptoms within that 10 days. So for people that go in for testing and test negative, whether or not they can come back right away depends on kind of the circumstances for why they went and get tested. If they went in and got tested because they were a close contact of someone who tested positive and they've been instructed to self-isolate for 14 days, if they test negative, they still need to continue that full 14-day period, because we don't know if they might develop symptoms sometime later in those 14 days. So even if they test negative on day 5, 10, 13, they still need to be out that full 14 days after their exposure. If someone tests negative and they weren't exposed, they went in for maybe they had similar symptoms, a cough or a sore throat, something like that. We're seeing that a lot with people who have allergies. And of course, when flu season comes back around, there's going to be a lot of respiratory illness out there. If they're having the COVID-19 symptoms and they go in for testing that way, we'd recommend they be out until they get the test results back. But then if those test results come back negative, they can come back 24 hours after their symptoms resolve, assuming they're not a close contact to somebody. Or if they just go into testing because they're curious and they want to know what their current status is, they can come back as soon as they get those test results and they're negative if they're not a close contact to somebody. When you have an employee that tests positive, the thing to really focus on is, were there any potential exposures within the business? And for that, we look back 2 days from when the person tested positive or when their symptoms started. So we want to look at any days that person worked while they were infectious, those 2 days before their symptoms started or the 2 days before their test. And then during those 2 days, we want to look back and see, was there anybody they were in close contact to within the business during those days? And everything outside the business, you don't need to worry about. That's what public health is here for. We're going to follow up and try to identify those contacts, but we can use your help on the business side, just working to help take care of your staff and customers as well. So you'd be looking at who is, about to get to the who's a close contact. So a close contact is anyone who was within 6 feet of the person for 15 minutes or more. And those 15 minutes don't need to be at one time. You can accumulate those throughout the day. So if, say, 2 people were meeting or working on a project and they were working side by side in close contact, that would be and there was more than 15 minutes, that would be an exposure. If they had a couple brief conversations throughout the day and they think they accumulated more than 15 minutes in 6 feet with a person, that would be an exposure. We've had some things come up at restaurants with questions about servers. If the server spent more than, test positive and they spent more than 15 minutes at their table within close contact of those patrons, that would be considered an exposure. So unfortunately, it's not too difficult to reach that 15 minutes, but that's why the social distancing precautions and things like that are so important, that you're trying to keep that 6 feet distance as much as possible to prevent those exposures. But so when you have the case, it's going back and looking at who are the other staff members that were in close contact with this positive staff member. Were there any clients that they were meeting with, any customers that they were seeing that would have met that 15-minute window? And then we would recommend that those people who were in close contact be notified that they need to self-isolate for 14 days after that exposure. And it's 14 days after the last exposure. So if you had, say, someone was working both days when they were infectious, staff member that worked with them both of those days, that person's 14 days would start on the second day, not the first day. But we recommend that they be notified, told that they need to self-isolate for 14 days. And then we also recommend anybody who is a close contact be tested. And we recommend that people typically go in for testing around day 4 to 7 after they've been exposed, because that's when we usually see people start becoming symptomatic. But they can really go in for testing at any point in that time. We just say that it should be at least 2 days after that exposure, because that's kind of the shortest we see the incubation period being. So we'd recommend those staff members or clients be notified. That notification should not include any identifying information about the person who tested positive. It should be kept as kind of as general as possible. There's been an exposure, you should be self-isolating, and really that's kind of the extent of what you should include. It shouldn't be about you're exposed to a server or a specific staff member, a specific department. It should be kept very general to protect the person who's ill's privacy. Beyond that, we don't recommend additional notification. Businesses can do that at their discretion if they think it would be more beneficial to their staff or customers to be informed of a potential exposure. But again, those notifications should be kept very general, and it should be clear that those that are at risk of that were in close contact have been notified to self-isolate. And if you were not contacted directly that way, you are not considered exposed. When you've had someone exposed, a staff member who's been exposed to a positive case, it's really important for that staff member to be self-isolating for 14 days after that exposure. And we get a lot of questions for, I have someone who's been exposed and they're self-isolating, what's the risk to my business? Or is there a risk to any other staff member? And really the important thing for that is looking at that 2-day window again. So when was the last time the exposed person was in the business? And based off of if they never test positive, never have any symptoms, then there's really no risk. If they end up going in for testing and then they test positive or they develop symptoms, then you need to look at, okay, when was the last time they're in the business and when did they test positive or start having symptoms? And then go back to look at, were they potentially at work still before they started self-isolating where they might have been infectious? And for that, it's really, as long as it's been 2 days since they were last in the business, there's not going to be any risk because they started self-isolating before they would have been considered infectious. If it's been less than 2 days, that's where we would kind of go back and follow the same protocols as if they were a case, and look for, okay, who else was possibly exposed during this infectious period, making sure they're notified and starting to self-isolate as well. So when someone's just been exposed, we don't recommend any notification, because at that point there's not really we don't know of any risk to other staff or clients. It would only be if that person were to develop symptoms or test positive and they were in the business while they were potentially infectious. That would be where we would recommend notification. We wouldn't recommend putting out anything if you just had a staff member who's been exposed and is self-isolating. kind of one exception to the exposure rule for people to be self-isolating for 14 days after that exposure is for essential workers. So with essential workers, they're allowed to continue to work during that 14-day exposure as long as they are wearing a mask while they are at work. Their temperature and they're screening for temperature and symptoms at the beginning and end of each shift, and they're no longer they're not having any symptoms during that time. If they meet all those criteria, they can continue to keep working while they're going through that 14-day self-isolation, but they should be self-isolating at home when they're not at work. So they should be coming straight to work, getting their temperature screened, wearing a mask the whole time, getting their temperature screened at the end of the day, and then going straight home during that 14-day period. So the essential worker guidelines are available on the CDC website, and out on that page, they outline who is essential, and there are 16 different sectors that are considered essential. Some common ones that they list are law enforcement, 911 call centers, other first responders, healthcare workers in the food industry and critical manufacturing, places like that. And it's really whether or not workers fall into those categories to be determined if they're essential or not. A business can't go outside of those guidelines and say, well, this person is essential to my business, so I'm going to say they're essential and they can keep working during those 14 days. They really need to be in one of those 16 sectors for that exception to apply. One last piece I wanted to talk about with exclusion is for people who have an ill household member. They've been exposed by a member of their household. And I want to bring this up because there are some circumstances where people can really be out for an extended period of time because it is 14 days from their last exposure. So if they have a household member who isn't able to take care of themselves and able to self-isolate away from them in the home, then their exposure doesn't end until that person's no longer infectious. So let's say it's an ill child or an elderly adult living in the home that requires care and they're having that constant exposure, then their 14 days isn't going to start until it's been 10 days after that household member's onset of symptoms and they've been fever-free for 3 days and their symptoms are improving. So when you look at that, people can be out for upwards of 24 days if it's a household member that can't self-isolate. So like I said, in those cases, it's really important for as much flexibility from businesses and employers as possible, because it can be an extended period of time. It's like it can be an extended period of time that someone's symptoms last, and we see that fairly often. I think that was all the information I had. I'm sure I went over my allotted time, but I will go ahead and pass it off to Jared.
Good morning, everyone. Hey, thank you very much, Josh. Josh is great with covering a lot of those particulars. He is definitely the subject matter expert on this. What I'm going to do is I'm going to talk kind of more generalities. I'm going to take a look at, some of the things that are currently going on in the community right now, and give you guys kind of an idea of what we're seeing from our perspective. Now, got to kind of take into account that we regulate certain aspects of the business community. Most notably, we regulate bars and restaurants. We regulate pools. A few other things as well. But kind of what we're seeing on the ground right now is, with bars and restaurants, we are seeing a relatively high level of infection. We're seeing there have been several instances within the last week and a half in the community where bars and restaurants have voluntarily closed down, primarily because they have enough workers sick that they literally cannot maintain opening the establishment until people are coming back, or B, they're finding out they have people that are positive. They're voluntarily closing for a few days. They're going through the exclusionary practices with their employees per the guidance, and then they're actually doing a deep clean of their establishment, trying to make sure that they're sometimes they're cleaning themselves, or they're getting a professional cleaning service in to do that before reopening. Another thing we're seeing here lately too, especially over the 4th of July weekend, this came up quite often, is pool closures. We've had several pools close. For some reason, it seems like in the last week, there's been a major tendency of lifeguards getting sick. So we're seeing numerous lifeguards getting sick at numerous pools in the area, and the pools essentially having to close down and exclude those employees from work. Without going into any details, we can say safely that it's pretty broad across the Cedar Valley. It's not a particular issue of one community or another. It's broad. So we're seeing that a lot. Another thing we're seeing too is an increase at daycare providers. We're seeing a higher number of infections roll out of daycares, and then there are some additional guidelines for those guys too. One of the things that we can't really see though, and I'm going to kind of use this space to kind of entreat the business community itself, is we don't really see things that we're not regulating. We're getting calls from businesses. We're getting requests for recommendations on isolation and quarantine, on cleaning procedures and things like that. But we really don't know how problematic this is, community wide, from a perspective of how are all of these businesses conducting or responding to this threat. And so if people are experiencing that, we'd love to hear from you. Call in, ask for me, and we'd love to just get a better idea of what that operating picture looks like out in our community today. So one of the things that we're going off of, and really kind of our primary source document for our recommendations, is the governor's proclamations. Now, she's made several proclamations over the last several months, ever since the pandemic began. The last governor's proclamation that we're working with was right at the end of June. And that extended a lot of those provisions, basically any of the existing provisions, through through July 25th. So that's kind of our next target date, where we could expect to see some more guidance come out from the state level and from the governor's office. Now, within that within her last proclamation, there's several items that were covered. There's very particular guidance on on establishments like restaurants and bars, casinos, fitness centers, any kind of senior citizen centers or daycare for children or adults, salons and barbershops. But it all really boils down to 2 points. So the social distancing is an absolute must. Under pretty much every business that falls within the scope of that proclamation, social distancing is a mandate. And so that's one of those things that whenever we're responding to this, we try to emphasize that social distancing among employees, social distancing between employees and customers, it's an absolute must. And you walk around in the community, and we do see a lot of social distancing. A lot of establishments have markers on the floor for people to stand in line or queue. Those are things that are great strategies to help deal with that. But it is incumbent on those business owners to enforce that within the boundaries of their own establishment or their business. And so we entreat all business owners to make sure that you guys are being very proactive with that, and that you are enforcing that mandate from the governor. Now, the second portion to most of the recommendations the governor's proclamation makes is other social distancing, hygiene, and public health measures. So this is one of those things that can truly encompass pretty much any safeguard or strategy that we have seen over the last, 4 months, however long this pandemic has been going on. Sometimes I lose track of time. But really, we're looking at what are those additional things we can do to make our businesses safer? What are the things that we can do as a community to help safeguard everyone across the board? And one of the things that we are absolutely pitching here is probably the primary focus is mask wearing, right? That all entities, we make that strong recommendation that those entities are wearing masks. Now, as a business owner, you can take things into your own hands with that. If you're not having masks or requiring masks for your staff or employees, we strongly recommend that you do that. There are enough masks out in the community now that a lot of people have them. I know with our inspections, and we've actually resumed inspecting in the community here recently, we are absolutely wearing masks. When we're going out and we're interacting with the public, we're ensuring social distancing. We're doing contactless inspections or assessments. We are wearing masks. We do screening questions, and we actually move forward with, trying to ask the other interested party to wear a mask as well. And if they don't have a mask, we provide one. So those are just some, some additional strategies that we'd like, like the community to look at. I think, from a personal perspective, everything that I have been able to understand and read about this is that wearing masks are pretty imperative. Now we know that it somehow become kind of a political issue or a hot button issue, but we rely strongly on the science and the data behind this, and the science and data is on the side. It basically states that we should be wearing masks. Other strategies to utilize here, could be additional cleaning measures that we put in, offering up hand sanitizer on location. Those are just some of the things that we can do, and we can definitely provide lists of additional strategies to help businesses add additional safeguards for their staff and for the general public as well. Last note here too, I want to get this out there too. This is more on the personal side of the house, but it definitely applies to everything we do in the business community. Is that there is a general right now essentially a general relaxing of the idea of not going out and going to events or parties and things like that. For us, from a business perspective, a lot of the events that are being held, that are held every summer, are closed down. We're looking at things like Irish Fest or Sturgis Falls or, any of the small town fairs or community fairs. A lot of these are closing down. And if they're not closing down completely, they are seriously backing off of the services or what they're actually offering at that event. So we do ask businesses to, take that into account too, that, hey, look, this is not over. We really can't be relaxing. We can't relax yet on this. And that, we still need to treat this as the very real threat that it is to the community. So thank you.
Jared, this is Bryan. Quick question that came in from the group. As long as you're talking about recommendations for businesses, what is the recommendation from the health department about telecommuting and working from home? Is that a recommendation from Blackhawk County Health?
I believe. Yeah, sorry, Bryan. I believe that would fall under kind of those additional strategies for adding safeguards. If you can telework, then that is going to reduce the potential for people getting infected and for spreading COVID-19. So that, I think, would fall without giving the official word on that. From the health department, as I would say that it falls definitely within the categories of additional safeguards that we could take to ensure the safety of the public.
That's great. Thanks, Jared. Several of you have asked in the chat about resources from Blackhawk County Health, and Nafissa has offered to send out the information that Josh and Jared have shared already. Also, check out their website. There's a lot of rich information from Blackhawk County Health's website, Iowa Department of Public Health, CDC. There's a lot of tools and resources out there. So please check those out. So Nafissa, I'll throw it back to you.
Thank you, everybody. Mike, do you want to touch base on the legislation that just passed?
You bet. All right, so I got to start out with a disclaimer. Nothing that I'm saying is legal advice, and I'd advise anybody in the business community to speak to their own attorney if they need specific legal advice concerning this. But I'm going to try to provide an overview of an act that was just passed and signed into law relating to how businesses may be held, or for that matter, may not be held liable relative to COVID-19. So it's called, it's Senate File 2338. It's called an act relating to civil actions, including recoverable damages for medical expenses evidence offered to prove past medical expenses, and civil actions related to the novel coronavirus, and including retroactive applicability provisions. So they came up with a short title, as you can tell there. But in any event, bottom line is this. A minimum medical condition relative to this act is a diagnosis of COVID-19 which either requires inpatient hospitalization or which results in death. Now, generally for premises owners, so these are business owners here, for a civil action against a premises owner, you need to either have a minimum medical condition, meaning inpatient hospitalization or death due to COVID-19, or an act intended to cause harm. So if you have somebody who's damaged intentionally relative to this pandemic, a business owner can be held liable, or you need actual malice. So you either need to have that hospitalization or death, or you need to have something intentional. Now, with respect to premises owner liability, if you have one of those things, a civil action can be held against you for coronavirus. However, with respect to healthcare in particular, healthcare businesses, meaning the hospitals, the clinics, the doctors, the medical staff, they are not liable for causing or contributing to COVID-19 injury or death if they are acting as part of the state's response to COVID-19, unless they act with either recklessness or with willful misconduct. And so basically, if they're trying to do their jobs, healthcare is not going to be liable. In addition, those involved in the manufacture, the sale, or the design of personal protective equipment, of sanitizers or other disinfectants, or of cleaning products are not going to be liable unless they act with actual malice or with reckless disregard to risks that a particular product or chemical could cause injury, death, or other damage. As for businesses, this act provides a safe harbor. The safe harbor says, in the event that a business is in substantial compliance with this act, or with the regulations and guidance related to COVID-19, and substantial compliance means you're taking it upon yourself to educate yourself with the appropriate guidance. You're taking it upon yourself to try to implement it in good faith and specific and with specificity. You're taking it seriously. If you have done that, you shall not be held liable for civil damages for any injuries sustained from exposure or potential exposure to COVID-19 if the act or omission which was alleged to violate your duty of care was in substantial compliance and or was consistent with any federal or state statute or regulation. And really what this comes down to is this is a changing situation we're in. It's entirely possible that leaders, regulators, whoever may get something wrong. Businesses, this act is to provide that businesses should not be held liable in the event that they're following this and it turns out the advice was bad and it turns out to spread the virus. Now, with respect to damages, this act limits them in one additional way, and that is that treatment expenses are limited to what is either A, actually paid, or B, would be accepted by a treatment provider as payment in full from health insurance. And you see this a lot if any of you have been involved in a personal injury action. where you receive, say, a hospital bill, and you look at a hospital bill and it might say $60,000, and then all of a sudden they accept $7,500 from insurance and bill the patient for $500 and write off the rest. That's a very, very common occurrence. And what this is saying, much as our civil law says that civil litigants can present in court, is that, look, the actual value for that portion of anyone's damages is limited to whatever is accepted as payment in full. So if it was $7,500 plus a $500 copay, that would be $8,000. One more point I would note is that this act does not impact workers' compensation in any way. So it does not affect workers' compensation relative to either COVID-19 or to anything else. And so with respect to how COVID-19 may play under workers' compensation law, that isn't entirely clear, though I have a hunch that if you had a work comp commissioner looking at things, they would probably consider that a danger that's inherent within the job. And of course, under the CARES Act, which I'm sure most businesses have now heard about, that's a federal act relating to unemployment obligations. There are additional unemployment benefits that will extend to victims of coronavirus or to workers who have family members who are affected by it or who have lost daycare due to it. So essentially, this act limits liability of businesses in three specific ways. Number one, it provides that you need to act essentially with actual malice or intent to harm, or there's got to be a very serious hospitalization or an inpatient hospitalization or a death resulting. Number two, it limits the amount that you're going to have to pay for treatment expenses. And number three, it provides a safe harbor if you are substantially in compliant with what is then the guidance that you're receiving or that's being given. So that's the new, as I said, it's called the new act relating to civil actions and damages. I'll cut it short. That's the nutshell version of that. This act is found codified in the Iowa Code. There are a couple of additional sections in Chapter 622 and Chapter 668, but primarily it is a new chapter, Chapter 686D. And so I'll turn it back to Nafissa at this time.
Okay. Well, thank you. So my ask today is one that is simple. My ask is for us to work together, to have that one voice. COVID has impacted all of us, whether it's the health department, the hospitals, the businesses. It's a pandemic that has really impacted the entire world. I, as the health director, I can say that one of the things that I'm asking of you all is to reinforce our messages. A lot of times, as we communicate the usage of face coverings, if businesses don't require that, it doesn't also empower the message. It gives a very confusing message to the community. So how can we work together to have that one message so that businesses also stay open and they're showing the importance of these preventative measures? We know that our hospitals are hurting. They went through, and some continue to go through the COVID crisis of just losing patients, but also revenues, and people are staying away from hospitals, right? So, and you're seeing that some populations that are of the vulnerable populations are very worried that others are not wearing face masks and social distancing. So I think it's upon us to do the right thing. I know I see throughout the community people are saying, you know, there needs to be a mandate for face masks, and I understand that, but I also think that we also need to do the right thing. We just need to do the right thing. We need to work together to reinforce the same message so that whether it's our patients, our customers, they understand the importance of these preventative measures. We're going to start going into flu season pretty soon, where we're concerned about the combination of COVID and flu, and we want to make sure that right now, if we can get patients to go to the hospitals to get their wellness exams, to their yearly checkups, to do those preventative health visits right now, as opposed to staying away from the hospitals and face dire consequences if they do get COVID. So I'm here to ask you all if there's any way we can reinforce the same messages, and what are some of your concerns in terms of requiring a face mask within your businesses. And I know some of you all already do. I see those that are advocating, those that are, you know, reinforcing the message. I see it throughout Facebook. And also educating their customers that get frustrated of this ask. I see it, and I applaud you. I commend you all for doing that. So I think that we really need to continue to work together to have that one message of these preventative measures. And we know that behavior change can happen without a mandate. When you start putting these measures in place where people realize, oh, if I have to go into this business, I need my face mask, so let me just have it on me. It's what we're trying to do is normalize the behavior until there's stability and we have a solution for COVID. But at this moment, with our numbers starting to increase, I don't see them necessarily declining. We have schools that are preparing to reopen, the university that's preparing to reopen. So these are all things that we need to gear up and be ready for. It's better that we say we over-prepared than we under-prepared because of the situation. So that is my ask of the business community, to continue to reinforce these preventative measures. The face covering is very important, especially in places where social distancing is not happening. And I know with local businesses, especially, sometimes the business is very small, and it's hard to socially distance. And so asking the consumers to wear the face coverings, I think it's a responsible thing to do. And so if there's any concerns or any hesitation of implementing those measures within your business, please do feel free to reach out to the health department. We will work with you all, whether it's messaging, whether it's flyers, we will work with you all. We just want to do the right thing for our community and also ensure that our hospitals can obtain that stability that is greatly needed. And I know they're hurting pretty bad, and so we don't want that to continue, and we just want to do the right thing for the community. So that is my ask of you all. And again, you know, if you want to have these conversations, business to health department, just please reach out. We are open to it. We will help you, whether it's again flyers, communication, so that you know the consumers understand that this is actually an ask from us of you all. I have no problem partnering with you all to do that. But thank you so much for your time, and please do know we see what's going on, and we empathize with you all. Those closures that we see that happen, it truly impacts us over here as well. And so I just wanted to reach out to see what is there that we can do, and how can we continue to help the community.
Nafissa, I thank you for sharing that, and I think we certainly hear your plea, and this dialogue with the business community is an important one. When you talk about compliance within our community, is that something that either the city, the county, the state is assessing fines, or looking at something more punitive for businesses? What are you hearing? What are you hearing, locally as well as across the state?
Yeah, locally right now, there's no particular mandate. You see it in other states where once the governor puts out a mandate, there is fines that are attached to it. Right now in Iowa, that is not the case. My greatest concern is that we have hotspots in Iowa. In Black Hawk County, we have everything that can create these hotspots. So we have meat packing plant, long-term care facility, university. I mean, there is absolutely everything here that can create these hotspots and outbreaks that we've seen. And so that's my plea is that, beyond this request of a mandate, we just need to do the right thing for our community. And we are fortunate to have, a robust healthcare system. When you look at our data and, the county health rankings in terms of just where we stand for access to care, I think we're rated 8 out of 99 counties, and I think because we have the healthcare systems that are here. But if we don't take on these preventative measures, in the long run, they're the ones that are going to hurt really bad, and we're seeing that trend nationally. So I think for us is to remember that we can change behavior by being that one voice, and by communicating that importance. It's a constant communication and constant request, but I just see a pattern where the health department is asking, but then businesses are not reinforcing. I mean, it doesn't place value on our ask, and so we want to work together so that also you all thrive. Businesses are important for the community and for the economy and for the health of a community. And so so I think no, there isn't right now. There hasn't been talks about that, but I just want to do the right thing for our community.
Sure. You talked, or maybe one of your colleagues talked about restaurants being one of the hotspots in our community, and bars and restaurants. Is there anything that Black Hawk County Health is doing to do any kind of drop-in visits, walking through those, making recommendations, those kind of things?
Yeah. Jerry, you can take.
Yeah, I'll take that. Thanks, Nafissa. So we have, ever since the pandemic started, we have been very, very present within the restaurant community by pushing guidance. As guidance has changed over, the months, we've altered that, tacked on it there as well. We've always maintained several of the inspections that we conduct out in the community to include complaints. And so I think we've seen an incredible uptick in the number of complaints we've received in regards to restaurants and bars in the community, and we've responded to each of those in kind. As I kind of stated earlier too, we've actually gotten the ability to resume our normal inspections. When I say normal, we're out in the field now conducting those inspections and assessments, but we're still utilizing a lot of the safeguards that I discussed as well. We're very, very present within the restaurant community, the bar community. We're making sure that we pass guidance along. I'll also state that the Department of Inspections and Appeals here in Iowa, they're essentially the agency that gives us our regulatory ability here in Black Hawk County and 5 surrounding counties, have been very great with pushing information out to us and out to all of the restaurants and bars as well. I think we've I think we're doing an okay job with that. You know, of course, a lot of the guidelines here do not allow us to we don't have, with just a lot of these things being recommendations, we don't have the ability to enforce a lot of the guidance that we would like. You know, like Nafissa had mentioned masks. We kind of been beating masks over the head today, but really that's one of those things that it is a guideline, it is a recommendation, it's not a mandate. So, you know, I would say we've probably received 50 or 60 phone calls, you know, complaints in regards to, you know, bars and restaurants and people not wearing masks. And at the end of the day, we can call those restaurants and make that recommendation again, but it comes down to whether or not they decide to step into that and you know, enforce that policy on themselves. So.
And I also just want to add that when we get complaints, because I know that community members, you know, some, depending on the situation, we do get complaints, but we always try to be objective. So we listen to the consumer, their concerns, and then we follow up and we are objective. We don't go into the business community as if, you know, that what we heard is what's actually happened. You know, we want to treat everybody fairly. And so we take our time to go through the whole process with the business community, like Jared said, but we stay objective until we get to the root cause of the problem. And I do believe we share some of the complaints and the concerns that have been brought to us. And so we take that as an opportunity to educate and just work with each other to resolve the issue.
Yeah, to kind of follow up on what Nafissa said there, we look at all of our businesses that we work with as our partners rather than, you know, just someone that we're regulating. We of course, we always try to take the tack that we're educators first and regulators second, you know, and so we try to provide people with the tools to be successful, you know, and in this case, there's just more tools. You know, this is us providing people with the knowledge and know-how to implement the safeguards that, you know, that are recommended to keep both their staff and the general public safe.
It's great. We're got a few minutes left here this morning. Any other questions? You can take yourself off mute if you want to jump in and ask a question. Not seeing any immediately here.
I have a question. I have a question. Stacey Bentley from Community Bank and Trust, and we have an employee who is being tested, and he was directly exposed, being tested, but it's taken him 4 days to even get to the test site. He's telling me, and then of course, then we have to start after that for. Depending on, he's self-quarantining and everything, but is that the case that we are that backed up in Black Hawk County that it's taking 4 days to even go in and get the test after exposure, or what's the status on testing right now?
So I can send Josh, if you want to add to that. I know that Test Iowa, there's just been a huge volume of requests for testing, so they're backlog. But one of the things that we've also emphasized is I think this is also an opportunity for people to really seek their primary care provider and call their physician's office. So, but you see a trend in the younger population where there's that need for the medical home. It's probably later on in life when you start having a family. But we have college age students that right now, we have the opportunity for them to establish medical homes here in Black Hawk County. And so that is going to be one of the key priorities of the health department to get people to understand the need to establish a medical home. And that is also how our relationship with the healthcare community works. I think it's the responsibility of public health to educate about the need for establishing a medical home. And so, Josh, are you hearing also more outside of what I just said in terms of testing, because I think it's Test Iowa that people are utilizing.
Nafissa, this is Pam Cordell. I can confirm that there are serious challenges around the testing right now. So this morning I was informed that Test Iowa is scheduling 4 and 5 days out. We have a serious issue with enough testing supplies inside of Unity Point Health, the entire system. We're trying to collaborate with Mercy One across town in their laboratory as well. I don't know if they're in the same situation, but our urgent cares have become so overwhelmed because of ball teams and all of these exposures that we're needing to go back into an incident command situation and try to work through that. So I was going to, circle back and call you because I think a lot of people are getting guidance with their family docs and such to get the testing because they have to wait to go back to work. And now our system is overwhelmed on that point.
Yeah.
So I wanted to add a few things on the testing. And so one, yes, we're hearing about the delays in people trying to go in for testing after an exposure. And that is troubling, and we'd like people to be able to get in for testing regularly because that testing is a key part of our disease follow-up and disease control for COVID-19. But it's not the only thing. And so while it would be we would like to have that access to testing so that employee can get in and we can rule out that possible exposure at the business. But the important part is that they are self-isolating at home, that they are not having additional contact with the business, and the risk, if they're not showing symptoms already, is lower. It's not zero, but it's lower. So while we don't have the complete peace of mind to say they're negative right now at this time, we know they're not having symptoms, they're not continuing to expose people within the business. And like I said, that a negative test, it gives us the peace of mind, but they're not going to come back to work soon. It would be that positive that would kind of help us inform. But it's really, that's the importance of as soon as we find out about an exposure, that people are moved into self-isolation, because that 2-day window is really early in the incubation period. They would need to be really they would need to be the earliest possible incubation period for there to be the risk from someone exposed to be infectious when they're last in the business. But we know that can happen, so there is risk there, and we want access to testing so that we can reduce that risk and eliminate as much as possible. But the important part is that isolation, that they're not continuing to expose, and that when they do get in for testing, hopefully they'll be negative when they go in, and we'll be able to completely rule out that risk. But kind of adding that when there's a lack of testing, it adds that additional importance to the self-isolation.
All right, we are coming on. Yeah, thank you. Thanks, Pam, for chiming in. Nafissa and team, thank you again for sharing all this important information. We'll probably look forward to having you back again in a probably not too distant future. We just appreciate the updates so much and the partnership with our business community. 2 weeks from today, we are going to have a similar town hall meeting with the superintendents of schools. I'm sure that will be a lively conversation as we look at what school looks like for this fall. But I want to thank everybody for participating. Thanks for the questions. And we are all in this together, that's for sure. So thanks, everybody.
Thank you.